welcome to the Ministry of Information. Once again, we are here for a COVID update, most importantly for the task force, especially the Director General of Ghana Health Service, to update us on some of the initiatives and interventions that they've put in place for us to control the spread of COVID in Ghana, and also how the vaccination campaign is going. We are privileged once again to have some dignitaries join us, and I would like to acknowledge them before we go for the main presentation. We have with us the Director of Health Promotion, Dr. Aboagye Da Costa. Dr. Da Costa is here. We also have the Director of Public Health, Dr. Franklin Esiedu Bequin. We have the Head Expanded Program on Immunization, EPI, Dr. Kwame Amponsa Achiano. We also have the Head Disease Surveillance at the Ghana Health Service, Dr. Dennis Laye. And of course, the Director General of Ghana Health Service, Dr. Patrick Kuma Aboagye, who I will call any moment to give us his opening address. And most importantly, we'll come back to you for your questions and go to him for his responses. So, Dr. Aboagye Da Costa, we are in your hands. Oh, sorry, Dr. Patrick Kuma Aboagye, we are in your hands.
Thank you very much, Honorable Minister, for the opportunity. Da Costa, do well, because people tend to mix our names up. All right. So, thank you very much, dignitaries here, friends from the media, my colleague directors. I think it's been a while since we gave you updates, and we felt it's right to give you an update, especially post reduction in the restrictions that occurred on 28th of March last year. So I'll talk to you about the general situation, where we are now, what are we doing in terms of guidelines at the airport, at the land borders, vaccination updates, and then also share the outlook with you. Currently, we are experiencing relatively very low cases. We have recorded low cases. So the average daily is about less than 20, and we have a weekly average of less than 5 per week. So that tells you that the numbers are quite low. Currently, 12 regions do not have any active case, which means there are 12 out of the 16 regions that do not have any cases at all. We don't have anybody who is on admission, severe or critical, anywhere in Ghana so far. There's been a significant decline in the number of cases reported at the airport for those few people who are tested. The land borders are open, and a little over 14 million of our population have received at least a vaccine. But unfortunately, the vaccine uptake has reduced, and that is so because the low risk perception. But the essence we want to highlight is the fact that this is the best time to get vaccinated, so that we fetch water when it's the dry season, when it's raining, and then when the dry season comes, you have some water to take. Currently, we have so far recorded about 161,172 cases since the outbreak, and we've done over 2.4 million tests have been done. Of this, 160,159 have recovered. Unfortunately, we have lost 1,445, and I must say in the last 2 or so months, we've not had any COVID-related deaths yet. Currently, our latest active cases is 40. Like I said, no severe, no critical case. Now, how do we compare ourselves with the rest of Africa? In terms of total number of cases, Ghana has recorded over 161,000. This is as at March, so that's why it's 160,000. ECOWAS has recorded about 901,000. That's the 16 countries of ECOWAS. And Africa had recorded about 11 million plus. We have significant recoveries, as mentioned. Case fatality rate for Ghana, that is the proportion that dies after the number, is 0.9. The lower, the better. And so West Africa has 1.3, but the African average is 2.2. So that tells you that the management has been much better, because the risk of dying is lower in Ghana compared to ECOWAS and African average. We've also done 2.4 million tests. That means that for tests per 1,000 population, which are internationally data record, is 75 as at March. As we speak now, we are doing about 79.8 per 1,000 population in Ghana. West Africa has an average of 36 and Africa 73. So we have a higher figure than the African average. I think this is a very usual chart you see. This is the waves. The last one was the tallest but the shortest. That's the Omicron one. You have the Alpha. The first one was the original version. You have the Alpha, we have Delta, and then we have the Omicron. So you can give them their different, the waves can have their own name, but they are dominant variants there. These are the usual charts. You can look at the active cases and the most region that has received the most, and it hasn't changed. You can see that our active cases are now in Upper East, Bono, Shanti, and Greater Accra. The rest of the country has no active case, as I said. So those four regions are where we have cases. The majority are in Greater Accra. That's why the color of Greater Accra is slightly deeper than the rest. I think this also shows the trends in active cases. Since towards around February or early March, when it dropped, it's remained quite low, virtually flat on the x-axis till now. Now, this is just the airport total average of total so far tested, positivity of 0.87%, and the majority are non-Ghanaians. It's just the own usual slide. Now, currently, all our borders are opened to human traffic and trade. Togo, Burkina Faso, and Cote d'Ivoire are yet to open their borders. And so that means that Ghana border is open, the others are not open, but we know that despite the closure, there are still trade still comes through, trucks are allowed to pass through, so those are things. And of course, there are people who find some way to get through it. So all the international travelers who are coming through are screened, and we are still in negotiation with our neighboring countries to see how we can synchronize activity, whether testing or whatever, but we are not going to do any tests for now. But we have means of testing that I'll take you details on how we do. The Ghana Travel Advisory, we've done a revision of the travel advisory. We always do, this is the 14th version that tells you if you are coming to Ghana, these are the things you need to have. These are the things you need to do to be able to qualify to enter. So that has been, that the details will tell you whether, for example, do you wear mask in the airport terminal? That will be there. Do you need to be fully vaccinated to come in? Or if you are not vaccinated, these are the conditions. So this is the advisory, which is always on the KIA website and sometimes on Ghana Health Service website. So what are these? Pre-arrival requirements. International travelers, other Ghanaian, non-Ghanaians, and foreign residents will require to be fully vaccinated prior to departure. And when we say you are fully vaccinated, Johnson & Johnson, 1 dose is classified as fully vaccinated, and the others are 2 doses. Booster is bonus, but you need to be, that's what we define fully vaccinated. And we take the vaccines that are registered in the 5 vaccines that are registered in Ghana, and we added 4 or so more that are WHO pre-listed. What it means that it's been approved globally by WHO, but Ghana has not, and so that one, people come in are allowed to come in with that. And every traveler will have to fill the Ghana Health Service declaration form. So we need to know where you have been the last 2 weeks, as we've been doing Ebola and now, because we still have outbreaks in other parts of the country. So if you are coming to a place where there's a risk, there's an outbreak there, then your risk level is higher, and so we may want to keep an eye on you. So that one is done, and that's it's an online application. For Ghanaian and foreign residents who live in Ghana, the full vaccination prior to travel to Ghana for 8 persons 18 years and above. Fully vaccinated will be exempted from the pre-departure COVID-19. If you are fully vaccinated, you'll be exempted from the pre-departure COVID-19 PCR from the point of embarkment. We also be exempted from tests on arrival if you are fully vaccinated. If you are partially vaccinated or unvaccinated, you will be required to present a negative PCR, not 72, this time 48 hours prior to travel, and you undergo the COVID-19 testing on arrival. And if you are not, you're also offered a vaccination on arrival, either at the sea, airport, or on the land. And we have systems there that offer these vaccines. So this is for Ghanaians and foreigners who are resident in Ghana. Otherwise, if you are not vaccinated, you are not allowed to come in at all. And persons 18 years, below 18 years. For non-Ghanaians, you must provide a full evidence of vaccination status to the airline prior to embarkment. For land borders, the traveler will be held responsible, and for the transit passengers, will be required to have a full proof of vaccination status, even if when you are doing transit in Ghana. So the next one is at the border posts. We do general physical screening of the travelers, doing temperature monitoring, etc. We will do a physical verification of a COVID-19 vaccination card. So the portal people have the samples of the other countries so that they can check. We also do a digital verification of the COVID-19 vaccination certificate using the PanaBios platform, which gives us information as to whether it's a genuine card or it's a fake card. So that one is done. And of course, you continue to inspect the yellow fever vaccination card at all levels, especially in the land borders where we have our neighbors still having some cases of yellow fever. So at the vaccination at the borders and NID, we say we are giving some vaccination. Vaccination of unvaccinated travelers who arrive at the border, mostly Ghanaians and foreign students, are vaccinated. You cannot prevent the Ghanaian from coming home. So vaccination of border residents as part of the COVID-19 ongoing NIDs. I mean, you know how our borders are. The same town, one chief, one half is one country, the other half. So to promote and protect ourselves, we do vaccination at the border to ensure that those people who are virtually coming in and out are also protected. We also provide logistic support for vaccination activities at the airport, at the border post. So now we've made some significant changes at our border posts, and these are photo gallery of at the KIA where people who arrive unvaccinated are vaccinated. One of the land borders where the team is there to vaccinate those who need to be vaccinated. The Jewiwav, Semenye, Akano, these are all our land borders where there's evidence of vaccination going on. We are also developing laboratories. We put one in Aflao, Elubo, and Paga. This is the model. It's almost 80% complete, and we hope that very soon all these laboratories will be there so that people can be tested. Which was done with support from UNDP and other partners. Now, we had a certain number of ports that were also not manned by Port Health. There's an ongoing process to man all of them, and these are some of the offices, prefabs that have been put there to ensure that Port Health presence is felt to protect us as and when people are coming in. As you know, now there's an outbreak of Ebola in DR Congo. And so these are all important systems that we need to continue to upgrade to protect ourselves. This is the Lekpebi Bafda one. So these are already in place and is currently working. So these are some of the logistics that have been sent to our border posts to ensure that once the border is open, we remain safe and all the necessary stuff are carried out. So, okay. So if you are coming as a traveler, what are you supposed to do? You have to upload your vaccination card onto the PanoBioStrated travel platform. So you create an account on the site and you're able to upload your vaccine card, or you use the UNDP endorsed Global Haven site, which is www.globalhaven.org. You can upload there. We will get it here so that we know that by the time you arrive here, we know that you are vaccinated, and this is that you have a genuine card before you are. So Port Health will have this information before you arrive in Ghana. So the fully vaccinated record, called the batch number, manufacturer, vaccination date, etc., are all keyed onto the platform. You upload the vaccination card, and the system will verify your vaccine record and issue you with a code and a pass. And that's the code and the pass that you come here, because Port Health will have had that information with you. So where are we as far as our vaccine states of vaccination? I mean, the vaccines itself are going to be so far received 30,378,000 plus. They've all been distributed. We distributed 23 million already. Some are still in the regions currently being used. And at the national level, we have about 6.6 waiting for redeployment should the numbers go down in the region. Majority of our vaccines are still remain AstraZeneca. So far, we've had about 9, for those who have received one dose, it's about 9.491 million, which comes about 47.5%. So we still have some way to go. For 29.9% of the population. For the fully vaccinated, we've done about 5.8 million of them, count about 29% of the 20 million that we have targeted, and about 18% of the total population. We have about 360,000 people who have received a booster since we started. As you know, this disease is more prevalent in the urban areas. But so with the vaccination, so far about 63 of those vaccinated, 2.3 are from the urban areas, while 37.7 are in the rural areas. And as usual, more females are vaccinated compared to the males. So we need to also work on that to ensure that more men get vaccinated. And of course, the youth, especially those below 18, still remains a higher number of population who are yet to be vaccinated, even though we are vaccinating up to 15. Okay, so if you look at the vaccination drive, which we really scaled up since December. In December, we vaccinated we gave out about 2.9 shots. January, it dropped after the Christmas festivities to about 1.6. In February, we did another hype of campaign. We did about 4.1 million doses in February alone. March was 1.63. There were a series of activities in March, so it dropped. April, we have so far done 959. But remember, we only started the campaign a few days ago. We are hoping that it drove into next month and be able to get more vaccinating than in May. I think this one is not too clear, but that shows you that the vaccination that has been so far done by a region and the total population that have been vaccinated in the regions. So far, the schools, we've done some vaccination, about 340 or so thousand, and we continue to do that. That is those under 15. As those who have done between 15 and 17 years, that's the number. There are some are in school, some are out of school. So that's the number we've done. If you look at the ranking in terms of total number of vaccines done, Greater Accra is the first when it comes to the first dose, but they are the 10th when it comes to fully vaccinated. So it's a balance. So we still have a significant number of people who have had their first dose, but they've not gone for their second dose in Greater Accra. And if you look at which will be shared with you, you can see that they are the least vaccinated is Savannah in terms of absolute numbers. Of course, if you look at the proportion, that will also change. But they also had probably the lowest number of cases in the country. But when it comes to fully vaccinated, they are 8th. And so it's a balance. So every region is being encouraged to ensure that they get as many people fully vaccinated as possible. But what we need to understand is that if you don't have had not enough cases and there's another outbreak, you are at more risk because you don't really have any protection. And so that's the message you are telling. I don't say it because we don't have cases here, you will not get vaccinated. Because when you have another outbreak, it is those unprotected that will be at risk. Remember recently we had an epidemic of the unvaccinated in Europe, and I think we don't want to move into that stage. I think the same slide goes on. So, how are we doing to improve vaccination? We want to continue with the periodic campaigns. We've done one in February, we are doing April, we do May and June, all moving towards a target of making sure that 20 million is done. We're also going to have special vaccination weekends. We are discussing with the education to give us one weekend where we'll move into all secondary schools and do mass vaccination. We want to do enhanced advocacy drive, COVID-19 campaigns, advocacy film, etc., to ensure that we keep up, and of course, with the help of the media, more people will take up the opportunity to vaccinate. Because there's a low-hanging fruit that we need to do to protect ourselves from the next outbreak. As you know, China still has lockdown, so nobody should ever think that Korea also had a surge that we are low and so we are free. But this is an opportunity to really get protected, so it shows that should there be any threat, we are all protected. The next slide. I think, how many of us are not wearing masks? Mine is here. Well, the president said it's not compulsory. He didn't say don't wear it. I think that's what I heard. He said it's not mandatory. He didn't say don't wear. The risk is still there. And so we recommend that where possible, wear your mask. And especially when you are in an enclosed and a congested place, you need to. I won't enter a lift without a mask. You know, a small place, 8 people, you never know. You know, so the most important, enclosed and congested places, where possible, wear your mask. If you are in an aircraft, small tube, 50, 60 people, 1 hour, 25 minutes, 45 minutes, nothing, no air exchange, I don't think it is right. It will be safer to wear your thing. Schools, we encourage that they continue wearing their mask because 15 years and below, those below 15 years have not been vaccinated. So they still remain a threat, a potential threat to them. And I think once you look at the enclosed and congested place, you can define yourself. You can, as I said, define which one is enclosed and congested, whether it's an office, whether it's in a banking hall, you need to wear. But we have to we are grateful to the banks for insisting that everybody must continue to wear their mask. Yeah. So what's our outlook going forward? Our various interventions have contributed to a general reduction in the cases, but this is not to say that the pandemic is over. It's not over at all. Some countries are experiencing a worse form of the pandemic, as we just mentioned. So we need to maintain our focus at preventing the worst case scenario. But vaccination, that is the most important intervention that we need now so that we can all be free and go up about business. We have enough vaccines and it's free, so the message is let's get vaccinated and still let's provide some of the protection, some of the hand washing, etc. has served us in many ways beyond COVID, and I think these are all areas we need to remember. So thank you very much, Honorable Minister.
Thank you, Dr. Patrick Kumar Boaji. We are all happy that the numbers are beginning to look good. And if we are in this state as compared to other countries, it should tell you that the commitment of government, the continuous support of partners or stakeholders, and the hard work of health workers, the COVID task force, the Ministry of Health, the Ghana Health Service, and allies, in no particular order, has really helped us to attain this feat. So I would like to thank all of them for making sure the entire population is safe. For you and I who are Ghanaians, the only thing we can do is to make sure if you are unvaccinated, get vaccinated. If you have taken your first dose, please get the top up. And if you are fully vaccinated, don't be complacent. Still adhere to the existing protocols. So I will now come to you, ladies and gentlemen. If you have any questions, Dr. Patrick Kumar Boaji and his team are here to take your questions. So you can raise your hand. We'll bring the microphone to you and take your question. Okay, so we'll take 1 and 2 and then 3. We can take 5 questions for this round. So if any other person has a question, we'll bring the microphone to you. So let's start from the lady. Your name, media house, and then
my name is Agnes. I work at the Chronicle newspaper. Doctor, please, may we know the regions, the 12 regions that don't have cases as of now? Thank you.
Thank you, Agnes.
Salam from the Finder. Doctor, you didn't talk about the number of vaccines you've had to discard due to lack of use or expiration. So if you could give us some.
Okay, thank you for the question.
My name is Sarah from TV3. I would like to find out with the special vaccination exercises that the service plans to embark on, how soon is it going to start and the target areas? I also want to find out, you said we are encouraging wearing of masks at the schools. What has been the engagement so far? Because we all know that the wearing of the mask is something that has totally stopped at most of the places, especially when the restrictions were lifted. It looked like freedom everywhere. The schools specifically, if we can find out how many of the students to have vaccinated from 15 years to the new number that was added. Thank you.
Thank you. So we take the 4th question.
Thank you very much. I missed the total number of cases we have as of now.
Okay.
At the time the president spoke, it was, I think I remember 74 nationwide. Where are we now? Have we made progress or retrogressed? And in that same announcement, he announced almost like a total easing of the restrictions and occasioned by the opening of land borders. Then he also said wearing of masks is no more mandatory. How has the opening of the borders made your work easier or difficult? What kind of protocols are you implementing at these borders that are now a free-for-all? And how does that protect or otherwise in terms of putting Ghana at risk of an unfortunate surge again? Thank you.
Okay, I think for the last part of your question, he already addressed it, but maybe he would use the opportunity to reiterate it. If we can take a last question, if we can take a fifth, but if there are no questions, then I will call Dr. Patrick Kumar Boaje for his intervention.
Thank you very much. If I didn't catch all your questions, just try and alert me. The regions without cases, maybe I mentioned the regions with cases. So maybe I'll go over the regions without cases. I said there were 4 regions without cases, that is with cases. Upper East, Bono, Ashanti, and Greater Accra. So the rest of the other 14 regions, Upper West, Northern, Savannah, Northeast, etc., do not have cases. I think that's okay. Vaccines discarded. There's always vaccine wastage. Either you discard, it breaks, or whatever, or storage is not optimum, and so you discard them. But there's a maximum, there's a percentage of 10%. The proportion that we have so far discarded is 4.4%. So we are way within the normal range of vaccine wastage that is acceptable. So it's 4.4, and that comes to really just about 1 million or so doses. But if you look at the fact that some of the vaccines arrive 2-3 months to expiry, it's expected that you get some wastage along the things I talked about. Education, engagement with education. Yes. We've been engaging in education. In fact, as soon after 28, the very first group that requested for guidance was education, and we are giving a written report to them about what to do. Before the end of the week, we will give them guidelines on other issues such as parents visiting, contact sports, etc. So we're giving them, we are going to engage them. We're also engaging them on vaccination, looking for, when we started vaccination, there was a break, so we really didn't come, and the school vacated, and with exams and vacations, so we booked. But now that they have reopened, we are going to go back and vaccinate them. I think in my presentation, I talked about the schools and those between 17 and 15. We were given out about 540 or so thousand of them have received vaccine. That is out of school, preschool, and some of them are in GSS, because it's a question of 15 years and above. So that's what we have. The number of cases I mentioned today is we have active cases of 40 total, and they are in 4 regions. There are 16 regions that do not have cases at all. Okay, there was a time, so it swings. We've had 24 before, 36, and go. So it's just swinging. If you follow the website, you see them there all the time, the total number of cases. The opening of the borders, maybe too early to say, but we had weighed out the risk. We had looked at the sub-regional prevalence to see, are they higher? They were low, so it doesn't really pose a major threat to us. But despite that, we're still putting systems in place to ensure that people are vaccinated, people are checked, and those who are suspicious, as you can see, we are putting labs there. We send logistics for them to be able to do their work in protecting us from that. There are Ghanaians who will go and come. So it's both ways. Even those who are leaving, we are making sure they are fully vaccinated and encouraging them that, because of course, if you are not vaccinated and you get there and you come back, you may, even if you enter, be vaccinated. So those are the border issues. But once the other countries open their border, we'll see the full impact of whatever risk. But looking at the number of cases they have in the sub-region, it doesn't pose any extra risk compared to our status now. I think those are all. He has a follow currency.
Is having another wave. This virus is mutating. Which variation of it is the most prevalent, maybe worldwide? And if I'm curious, what is happening in China? In my mind's eye, I see that if I can afford it, I'll leave China and come to Ghana, which has a free entry and a freer life, so to say. Are vaccines at our disposal able to handle the mutated variations of this virus as it progresses? Thank you.
Yeah, thank you. I think China is Shanghai and a few towns where they've had this outbreak. We can say the vaccines have worked very well for us because our numbers are down, and the heat of the outbreak of cases was very clear that it was the unvaccinated who were, majority were getting the COVID, and those who were getting very sick were unvaccinated. So it was very clear that the protection that the vaccine gives, either from preventing from getting vaccine or getting severe disease, was very clear. So I think our vaccines have helped us so far, and that's why we continue to promote it, to look at that. But as to whether you have money to come to Ghana or China, I think that one is another question. Thank you very much. Okay.
So we'll take the last set of questions. Okay, we'll take the two. Please, if you have any question, this is our final round. So.
Okay, thank you. My name is John Awuni Kesbin. Recently, former President Mahama at the 24th African Business Conference in Harvard, that's University of Harvard, said that Ghana testing currently per 1,000 population, 5.5 is what is tested. So I just want clarity from the Director General whether indeed that is the statistics available to the Ghana Health Service. Thank you.
Okay.
Yeah, good morning, Doctor. What has been your vaccination activity in close camps like prisons and other places where people really cram in their prison cells? Sometimes one leg is here, the head is there, and things. What has been the vaccination activity over there? And then recently, because the government said, or the president said that it's not mandatory, the churches have gone back to the normal distance where they have crammed in areas where there are no proper ventilations. What would you advise on those things? Thank you.
Okay, thank you. I take that to be the last question. Yes, please, go ahead.
Yeah, Doc, pardon my fascination with China. What have we done right that China got wrong? If it's supposed to be a superpower and it's having a lockdown, I'm just curious. Is it that they don't have the vaccines? Their vaccines are not effective? Because if we look up to China, how did we pass when they failed? Thank you.
Thank you.
So thank you very much. I think I mentioned testing per 1,000. Is you look at your population, the total number of tests you've done, and then you. So these are variables and times 1,000. If you look at our 2.4 plus million tests we have done, and that includes those that are recorded. You know, there are times also the private sector, they were not reporting, only reporting those who turn positive, or those who are negative. So we have to actually hire data collectors to make sure we gather that data. Even then, that gives us currently about 79.8 per 1,000. And like I showed in the previous slides, it's the highest, it's higher than the African average, the highest in the sub-region, in the West African sub-region. And so that one is clear. That is for those recorded. And even if we were to add a lot of the tests that were not recorded, our ratio would have been much, much higher. It's a very important indicator because some countries are benchmarking on that and are removing, allowing countries to come into their country or living. So I think So that's why it's not 5.5, it's 79.8 per, and that's at March, so 75 in the global scale. The churches, I think it's not only the churches, everybody is going back to some full capacity conferences, etc. But it's still about vaccination, about ensuring ventilation, about ensuring some social distancing. And I believe the churches have done very well. I mean, most churches, when we started campaigning and we went to their church to vaccinate, it were the pastors who were helping us. The last time we went to Slovenia, a Catholic priest just in public just took the vaccine for everybody to see how important it is. So if you look at the fact that less than 30% are fully vaccinated in the country, then the issue is everywhere. Just that everywhere, wherever there is congestion, where there's crowd, and the necessary risk must be taken. The last question is on the China. What I think is I'm sure there are parts of China that do not have any cases. And so we really want to assign any reason to that. They have different strategies, there are different vaccines. So there are many, many things. And I'm telling you that if we just, we are careless and we allow cases into the country, we can also get the same place. I'm not saying they were careless, but if you are unfortunate there are cases coming, definitely you are. And that's why we continue to ensure that people, despite the easing of restrictions, we still take our own life in our own hands and making sure that we protect ourselves. Like I said, I will never enter a lift without wearing a mask. You see, even in the early phases, those were the places really concentrated. And you know that the prisons insist on tests, etc., even before they put you in there. So they work hard to ensure that they don't put people who are likely to be positive not in the room. So they actually keep you in a cell and give your test before you are put in there. So there's been systems in place from March 2020 just to ensure that these places remain safe. That's why we've not had many major outbreaks in our prisons. Otherwise, we would have had them everywhere. Thank you.
On that note, I would like to thank Dr. Patrick Kumar Boaje and his team for joining us this morning, and to the media and all our guests who are here. Thank you so much, and we hope to meet you some other time. Good morning. Pause.